Imagine enjoying a relaxing time in nature, taking a walk in the woods, having a picnic in the park, or just sitting in the green grass, without realizing that a small threat could be lurking around. A tiny, almost invisible tick could be the cause of dangerous Lyme disease, a condition that may seem mild at first, but if ignored, can develop into a serious chronic health problem. How can we prevent it? We'll discuss important strategies to protect yourself from chronic Lyme disease. What is Lyme disease? Lyme disease is a bacterial infection caused by Borrelia burgdorferi, and in some cases, also Borrelia mayonnaii. The bacteria is transmitted to humans through the bite of infected small ticks, specifically black-legged or deer ticks. The disease was first recognized in the 1970s in the town of Lyme, Connecticut, United States, from which the disease takes its name. Since then, Lyme disease has become one of the most common diseases transmitted by insect vectors in many parts of the world, including North America, Europe, and Asia. Lyme disease is not a disease that can be transmitted directly from person to person. Its spread occurs through the intermediary of infected ticks. The very small size of ticks often makes them difficult to detect. In the nymph stage, they are even smaller than a sesame seed, while adult ticks are the size of an apple seed. Although small, these ticks can cling to the body of a human or animal for several days to suck blood. Transmission of Borrelia bacteria to humans usually occurs if the tick remains attached for more than 24 to 48 hours. Therefore, identification and removal of the tick as early as possible is essential to prevent infection. Lyme disease can develop into a chronic condition when the initial infection is not detected promptly or does not receive adequate treatment. This condition is known as post-treatment Lyme disease syndrome, where symptoms of Lyme disease persist for a long period of time, even after antibiotic treatment has been completed. While not all Lyme disease patients develop chronic conditions, those who do often face significant physical and emotional challenges. To prevent Lyme disease, it is important to understand where ticks carrying the disease are typically found and when they are most active. Ticks that transmit Lyme disease, especially black-legged ticks, live in specific environments that provide ideal conditions for them to survive and reproduce. Here are the habitats ticks infected with Borrelia burgdorferi bacteria are usually found in. Damp forests. This is one of the favorite places for Lyme disease-carrying ticks to breed and survive. Environmental conditions rich in moisture, thick foliage, and relatively stable temperatures make forests an ideal ecosystem for ticks, especially black-legged ticks. These habitats provide ticks with all the essentials, from shelter to access to hosts they can attack. Ticks rely heavily on moisture to survive. Their small bodies and susceptibility to dehydration mean they require environments with high humidity levels. A humid forest, especially after rain, provides the perfect conditions for ticks to find hosts and reproduce. Lush forests, with lots of trees and vegetation, provide natural shade that protects ticks from extreme temperature changes. Under these conditions, ticks can remain active throughout spring to fall, which is the most productive period in their life cycle. Forests filled with dry leaves, fallen tree trunks, and shrubs provide ideal shelter for ticks to hide from predators. These places are also locations where they wait for passing hosts. Tall grasses and shrubs. This is one of the most common habitats for black-legged ticks. These habitats not only provide shelter for the ticks, but also allow them to easily wait for passing hosts. These areas of dense vegetation are often found at the edge of forests, open fields, parks, hiking trails, or even in poorly maintained yards. The dangers of these habitats often go unnoticed, as ticks are very small and hard to see, but they can pose a major health risk. Tall grass and shrubs provide shade that protects ticks from direct exposure to sunlight and strong winds. Ticks are highly susceptible to dehydration, so they need a moist, shady environment to survive. Dense vegetation helps keep the soil moist and creates ideal conditions for tick activity. Ticks use a behavior called questing to find a host. In this behavior, ticks will climb the tips of tall grass or shrub branches and extend their forelegs to capture passing hosts. Tall grass provides a strategic position for ticks to detect and attach to passing humans, pets, or wild animals. Dry leaf pile. This habitat may seem harmless, just part of the natural environment commonly found in the fall or in unkempt yards. However, beneath its seemingly unassuming presence, a pile of dried leaves can be the perfect habitat for ticks. These piles provide an ideal environment for ticks to shelter, breed, and wait for a host to pass through the area. Many people don't realize that simple activities, such as playing or cleaning leaf piles in the yard, can increase the risk of getting a tick bite. Adult female ticks often choose piles of dry leaves as a place to lay their eggs. These eggs are protected by a thick layer of leaves, making them safe from predators and adverse environmental conditions. Once hatched, the larvae and nymphs can easily find small hosts, such as mice or birds, that also use leaf piles as shelter. Black-legged ticks have activity patterns that are heavily influenced by their life cycle, seasonal changes, and environmental conditions. Understanding when ticks are most active is an important step in preventing exposure and reducing the risk of bites that can lead to Lyme disease. Tick activity is not the same throughout the year, but there are certain periods that are considered high-risk times, especially in regions with significant tick populations. Spring to early summer, around April to July, is the time when ticks are in the nymph stage. At this stage, ticks are very actively seeking hosts for blood, which is necessary to grow into the adult stage. Nymphs are very small, only about 1 to 2 millimeters in size, making them difficult to see with the naked eye. Despite their small size, nymphs are the most dangerous stage in the tick's life cycle, as they often go undetected until a bite occurs. Transmission of Borrelia burgdorferi bacteria from nymph ticks to humans or pets is very common during this period. Fall around September to November is the period when adult ticks become very active. Adult ticks are larger than nymphs, measuring about 3 to 5 millimeters, making them easier to spot. However, despite their larger size, adult tick bites still pose a risk of transmitting the bacteria that cause Lyme disease. Adult ticks often seek out larger hosts, such as deer, dogs, or humans, for blood before going dormant for the winter. Transmission of bacteria from adult ticks is less common than from nymphs, but remains a significant threat during the fall. In winter, especially in regions with sub-zero temperatures, ticks usually enter a dormancy phase, where they go dormant and survive underground or in sheltered leaf piles. However, if the winter is warmer than usual, ticks may remain active in certain areas. Thick piles of leaves, fallen wood, or other vegetation can create a microenvironment warm enough to sustain tick activity over winter. This means the risk of tick bites does not completely disappear despite cooler temperatures. Ticks are usually most active during the afternoon to evening, especially at times when temperatures are warm and humidity is high. At these times, ticks are more active in seeking hosts by climbing the tips of tall grass or leaves. As tick active times often coincide with the hours humans are outdoors, the risk of tick exposure increases during the afternoon to evening. Ticks are most active at temperatures between 10 and 30 degrees Celsius. Temperatures that are too hot or too cold can reduce their activity, but do not completely eliminate the risk of a bite. Lyme disease is often referred to as the great imitator because its early symptoms are often vague and similar to other medical conditions. This represents one of the main challenges in treating Lyme disease. As a result, many people ignore the early signs, allowing the infection to spread and develop into a chronic condition that is difficult to treat. Early symptoms of Lyme disease usually appear within 3 to 30 days after a tick bite. However, not everyone experiences the same symptoms. Some symptoms may be mild and taken for granted, while in others, symptoms may develop faster and be more severe. Here are some of the most common early signs. First, erythema migrans. The erythema migrans rash is one of the most characteristic signs of Lyme disease. While not everyone infected with the disease develops the rash, its presence is often an early indicator that a person has been exposed to the Borrelia burgdorferi bacterial infection. The rash is one of the first symptoms to appear after a tick bite, providing an important opportunity for early diagnosis and treatment before the infection spreads to other organs of the body. Understanding the characteristics, variations, and implications of erythema migrans is essential for anyone looking to protect themselves from the risk of Lyme disease complications. Literally, erythema migrans means diffuse redness. The term refers to a ring-shaped rash that develops at the site of an infected tick bite. The rash usually starts with small red patches and gradually enlarges over days or weeks, creating a ring-like or bullseye pattern. Erythema migrans usually appears within 3 to 30 days after a tick bite. The rash may develop slowly over several days or weeks. Starting with a small diameter, the rash may expand to reach 5 to 30 centimeters or more. In some cases, the rash may continue to grow over time if left untreated. It is not always painful or itchy, so it often goes unnoticed by patients. However, in some people, the rash may be warm to the touch. In certain cases, more than one rash may appear on different parts of the body, indicating that the infection has spread throughout the body. The rash is caused by the body's response to the presence of Borrelia burgdorferi bacteria transmitted through tick bites. When the bacteria enter the skin tissue, the immune system responds by causing localized inflammation around the bite area, which triggers the appearance of the rash. At first, the rash may appear as small, inconspicuous red patches, but over time, it may expand, forming a distinctive ring. If left untreated, the rash may continue to grow in size and spread to other parts of the body through the bloodstream, signaling that the infection has become widespread. Although the rash is often described as bull's eye, its appearance can vary greatly depending on the individual and the stage of development of the infection. These variations sometimes make the rash difficult to recognize, both by patients and medical personnel. The most common form that characterizes Lyme disease is a rash with a concentric circle pattern, where the center is lighter and the edges are darker. In some cases, the rash is not perfectly circular, but has irregular edges or an asymmetrical shape. This can be mistaken for an allergy or a rash due to skin irritation. On light skin, the rash is usually bright red in color. On dark skin, the rash may look darker, tanner, or purple, making it less conspicuous. Some rashes are just solid red patches with no concentric pattern, which makes them look like regular insect bites. In the advanced stages of infection, secondary rashes may appear on different parts of the body far from the tick bite site, signaling that the bacteria have spread through the bloodstream. As these rashes are rarely accompanied by pain or itching, many people are unaware of their presence, especially if they appear on hard-to-see areas of the body, such as the back of the knees, or scalp. Many people don't realize they've been bitten by a tick, mainly because tick bites are usually not felt. This keeps them from associating the rash with Lyme infection. Variations in the shape and color of erythema migrans can cause this rash to be mistaken for other skin conditions, such as allergies, eczema, or common insect bites. About 20 to 30% of Lyme disease patients do not have an erythema migrans rash, making early diagnosis more difficult without obvious physical signs. Second, flu-like symptoms. One of the most common, yet often overlooked, early symptoms of Lyme disease is flu-like symptoms. These symptoms include fever, chills, fatigue, muscle aches, and headaches. While these symptoms look like the common cold, the difference lies in the timing of their occurrence and the potential for serious risks if left untreated. Flu-like symptoms usually appear within 3 to 30 days after the bite of a tick infected with Borrelia burgdorferi bacteria. Since seasonal flu is common, many people do not attribute these symptoms to Lyme disease, especially if they are unaware of the previous tick bite. Mild to moderate fever is the most common symptom. Unlike the common cold, the fever from Lyme disease can last longer and often appears along with other symptoms such as joint pain and rash. Body chills for no apparent reason often come along with the fever, even if the surrounding environment is not very cold. Headaches experienced by people with Lyme disease can be persistent or come and go. They are usually milder than migraines, but enough to interfere with daily activities. These headaches become more severe when the infection spreads to the nervous system. Extreme fatigue is one of the most noticeable symptoms of Lyme disease. Unlike normal fatigue, it makes the sufferer feel completely drained of energy, even after adequate rest. Third, joint pain and stiffness. These symptoms may appear in the early stages of the infection and develop into more serious ones over time if the Borrelia burgdorferi bacteria spread throughout the body. In some people, these joint pain symptoms can be the first sign of Lyme infection, while in others, this condition appears as a long-term complication called Lyme arthritis. The Borrelia burgdorferi bacteria can spread through the bloodstream and invade the tissues around the joints, causing inflammation. This inflammation is the body's response to the bacteria, but it can cause pain, swelling, and stiffness in the joints. In addition to direct infection, the immune system sometimes overreacts to the presence of bacteria. This excessive immune response can damage joint tissue, causing chronic pain and stiffness. Inflammation from Lyme infection can lead to fluid accumulation in the joints, known as joint effusion. This condition makes the joint feel swollen, stiff, and difficult to move. In the early stages of Lyme disease, joint pain often moves from one joint to another. For example, a person may feel pain in the knee one day, then the next day feel pain in the shoulder or wrist. Large joints, such as the knees, hips, and shoulders, are the most commonly affected areas. Pain in these joints can feel like a regular ache, but is often more intense and accompanied by stiffness. Stiffness is often felt in the morning or after periods of inactivity, such as prolonged sitting. Patients may find it difficult to bend their knees, raise their arms, or grasp objects. In advanced stages, the affected joint may look swollen, red, or feel warm to the touch. This swelling is often accompanied by significant pain. Joint pain from Lyme disease can last for weeks or even months if left untreated. In some cases, this pain can become chronic, even after the infection has been treated with antibiotics. Fourth, early neurological disorder. This condition occurs when the Borrelia burgdorferi bacteria spreads through the bloodstream and begins to invade the central and peripheral nervous system. This infection can lead to serious complications that affect motor, sensory, and cognitive functions. When these bacteria reach the central nervous system, i.e. the brain and spinal cord, or the peripheral nervous system, they trigger inflammation that disrupts the normal functioning of the nerves. The immune system responds to the presence of bacteria by producing inflammation to fight the infection. However, this inflammation can also damage the nerve tissue, causing significant impairment of nerve function. In some cases, bacteria can directly infect the nerve tissue or cerebrospinal fluid, which serves to protect the brain and spinal cord. These infections can cause serious neurological symptoms, including Lyme meningitis. Early neurological disorders in Lyme disease can vary from mild to more serious symptoms. Some people feel a sharp or burning pain along certain nerve pathways. These symptoms can affect a person's ability to perform daily activities, such as grasping objects or walking. One sign of Lyme nerve damage that usually occurs suddenly is Bell's palsy, a condition in which one side of the face becomes paralyzed or weakened, making it difficult for the patient to smile, speak, or close their eyes. Lyme infection that spreads to the brain can cause persistent headaches accompanied by neck stiffness. These symptoms are often early signs of Lyme meningitis, which requires immediate medical treatment. Recognizing early symptoms and acting quickly is key to protecting yourself from the dangers of Lyme disease. The sooner the infection is detected and treated, the better the chances of preventing serious complications and ensuring a full recovery. Effective prevention measures include a variety of strategies, from protecting the body during outdoor activities to keeping the home environment from becoming a habitat for ticks. Here are effective prevention measures to avoid Lyme disease. First, wear protective clothing. Wearing protective clothing is one of the most effective ways to prevent tick bites, especially when you are outdoors, in areas where there is a high risk of tick populations. Protective clothing acts as a physical barrier between your skin and ticks. Ticks often crawl on the skin before attaching and starting to bite. With clothing covering the body, ticks have fewer opportunities to reach the skin. Parts of the body, such as the ankles, waist, and behind the knees, are areas that are prone to tick bites. Protective clothing helps protect these areas that often go unnoticed. Choose a shirt that has long sleeves and fits snugly at the wrist to ensure your skin is fully covered. Use shirts with high collars or additional neck gaiters to provide extra protection to the neck area. Avoid loose-fitting shirts, as ticks can crawl into the folds of the fabric. Wear long pants that cover your legs up to your ankles. Tuck pants into socks for added protection at the ankles. Use clothing made from durable materials such as nylon or polyester. Choose lightweight and breathable materials to stay comfortable when used outdoors, especially in hot weather. Choose thick and long socks to cover the entire ankle and the bottom of the foot. Use closed shoes such as hiking boots or boots that protect the feet maximally. Avoid using sandals, open shoes, or footwear that does not provide full protection. Hats also help prevent ticks from falling from twigs or leaves onto hair. Choose a hat with a wide brim to protect your head, face, and neck from ticks. Use a head covering such as a scarf or bandana to protect the neck and ear area. If possible, use a hoodie that can provide extra protection. Choose clothes in light colors such as white, beige, or light yellow. Light colors make it easier for you to see ticks that may be attached to the clothes. Avoid dark-colored or patterned clothes tend to make it difficult for you to detect ticks, especially ticks in the very small nymph stage. Second, use insect repellent. Insect repellents containing active ingredients such as DET, permethrin, or picaridin are very effective in preventing tick bites. Insect repellents create a chemical barrier on the skin that prevents ticks from attaching and biting. This is especially important for protecting areas of the body that are not covered by clothing, such as the face and neck. Modern repellents are designed to provide protection for several hours, allowing you to safely go outdoors. In addition to preventing tick bites, repellents are also effective against the bites of other insects, such as mosquitoes, which can carry diseases such as dengue fever or malaria. DET-based repellents are one of the most common active ingredients in insect repellents and are proven to be effective against ticks. Repellents with DET concentrations between 20 to 30% are recommended to provide optimal protection against ticks and other insects. These repellents are effective up to 6 to 8 hours after application, suitable for use on skin and clothing. Permethrin-based repellents are chemicals used to treat clothing, shoes, and outdoor gear. Permethrin kills ticks on contact, providing added protection against tick bites. Spray on shirts, pants, socks, shoes, and hats, and allow to dry before use. Some outdoor clothing brands provide clothing that has been processed with permethrin during manufacturing. These garments can provide protection over multiple washes without the need to spray additional permethrin. Picaridin-based repellents are a newer and more skin-friendly alternative to DEET. It is effective against ticks and other insects, with a protective effect of up to 8 to 10 hours. They are non-sticky and do not have a strong odor like DEET. Some repellents use natural ingredients such as lemon eucalyptus, citronella, or lavender oil, great for those looking for a chemical-free alternative. Third, check your body after outdoor activities. Thoroughly checking the body after outdoor activities is an often overlooked yet very important preventative measure to prevent Lyme disease. A body check allows you to find attached ticks before they bite or transmit bacteria. Ticks tend to seek out warm, moist, and hidden areas of the body. Focus the examination on areas such as behind the knees, armpits, hair, neck, behind the ears, waist, and groin. Ticks in the nymph stage are very small, so using a magnifying glass can help detect them more easily. Bathing in warm water helps remove ticks that have not yet attached to the skin. Immediately wash clothes used during outdoor activities in hot water. If possible, dry the clothes in a dryer at a high temperature to kill any ticks that may still be attached. If you find a tick attached to the skin, use pointed tip tweezers to remove it. Pinch the tick as close to the skin surface as possible, then gently pull it off without twisting or crushing it. Once the tick is removed, clean the bite area with an antiseptic. Fourth, take care of the home yard. The yard is a place where family members, especially children and pets, often play or do activities. Cleaning the yard reduces the chance of direct contact with ticks waiting in dense vegetation or leaf piles. Ticks residing in the yard can attach to clothing, skin, or pet hair and be carried into the house. This increases the risk of tick bites inside the home, even when not outside. Tall grass is a favorite habitat for ticks to hide and wait for a host. Make sure the grass in your yard is always trimmed short, especially around areas that are frequently used, such as playgrounds or pathways leading to the house. Piles of dry leaves or twigs provide an ideal moist environment for ticks to breed. Clean up fallen leaves and remove twigs regularly, especially in the fall or after rain. Add barriers such as gravel or mulch around garden areas or home fences. These barriers create tick-free zones that reduce the chances of ticks moving into your yard. Designate a play area away from dense vegetation or tall grass. Make sure this zone is frequently maintained and kept clean. If you have garden furniture such as benches or swings, make sure they are placed in areas that are clean and free from dense vegetation. Fifth, protect pets. Pets, especially dogs and cats, are often the target of flea bites due to their outdoor activities. In addition, pets with fleas can bring the fleas into the house, increasing the risk for the whole family to be exposed to fleas. Pets often play outdoors, such as in parks, forests, or areas with dense vegetation, which are tick habitats. They tend to explore bushes or tall grass, where ticks usually wait for a host. Pet hair provides an ideal place for ticks to hide and attach undetected. Fleas can easily transfer from animal fur to home furnishings, carpets, or people. Unlike humans who can wear protective clothing or use insect repellent, pets depend entirely on their owners to protect them from fleas. Pets affected by fleas often scratch or bite certain areas of the body due to itching or irritation. Fleas look like small brown or black dots attached to the pet's skin. Check areas such as the ears, neck, armpits, and underbelly. Apply a veterinarian-recommended anti-flea medication, such as a spot-on treatment, oral tablets, or an anti-flea collar. Bathe pets regularly, especially after they play outdoors. Use a special shampoo formulated to kill fleas and prevent infection. Wash pet bedding, blankets, or toys regularly in hot water to kill any fleas that may be attached. Don't let pets play in leaf piles, tall grass, or shrubs, especially in tick-active season. Chronic Lyme disease can be prevented with simple yet effective measures, from wearing protective clothing to using insect repellent to keeping your environment clean. All these efforts help protect you from the threat of serious illness. With the right strategies, you can enjoy your time in nature without worrying about the risk of tick infection. Remember, your health is the biggest investment in life. Thanks for watching. Don't forget to like, subscribe, and comment. Stay healthy, stay alert, and see you in the next video.